My name is Linda Nguyen, and I was diagnosed with COVID-19. It was a quick onset. I was feeling fine the day before, and then, I had a little teeny tiny cough, and then shortly after that, I began to have chills, and then the fever escalated pretty quickly.
Clinically, this disease initially starts with a fever, starts with a cough, shortness of breath. These are non-specific symptoms. You have to find its genetic material, right? That's how we know that this virus is present. So it requires laboratory testing.
The importance of testing has risen to the top because the thing that will control this epidemic is going to be our ability to test and identify patients with disease.
This was pretty new in Chicago at that time, but they had set up a walk-up tent where you could go get registered and be tested. They took my vital signs and asked me some questions, and I was tested with a nasal swab. I had the test results back within a day. Having a positive test result was really important for me, actually, because with the positive test result, I really was able to notify everybody who had been possibly exposed or who I had possibly exposed at work.
COVID-19 represents a distinct challenge. There have not been a lot of tests that have been available, so we have tried to move as quickly as possible and be flexible in this setting to provide as much patient testing as we can, as early as we can.
So the first couple of days of COVID were very much flu-like symptoms. There was a lot of fevers and chills. The illness continues to get worse as time goes on. So actually my toughest days were probably the beginning of the second week of being ill. I was definitely scared. There was a point about 7 days after I had been diagnosed with the coronavirus that I had some trouble breathing. It was at that time that I realized I needed to go to the hospital. I was in the hospital for 5 days. That is about the length of time of the course of antibiotics. I really did not start to feel much better until about day 4. That's when I feel that the antibiotics really kicked in. And I realized that I could get up and walk from my bed to the window without being short of breath. I can't say it enough times. I have never been that sick in my life before. So I have to be very careful. I wear my mask when I'm outside all the time. Also, lots of hand washing and trying to keep things as clean as possible. Sometimes I think that people can't see what goes on behind the scenes, but I think that the lab is a very critical portion of this coronavirus pandemic. I think that without them, that we wouldn't have this high volume of tests, that we wouldn't be able to diagnose people quickly and get them all the treatment they need.
The lab team continues to amaze me. The staff volunteered to fill extra shifts to meet the needs of the patients so that we could get the testing done in a timely fashion.
It's really a supportive team that we have here, and I'm really grateful to be a part of it, and there's always someone to help.
I would tell anybody who was waiting for their coronavirus test that they need to act as if they were already coronavirus positive. This is something that is for the safety of the community. If you think that you might be positive for the coronavirus, we want to limit transmission as much as possible. So that would include having a strict quarantine until your test results come back.
Everybody needs to take this seriously. I think people watching this video understand the gravity of the situation we're in. Everybody can contribute. If your contribution is making sure you don't infect others, looking in, calling people who are socially isolated and lonely, take care of each other, do what you can right now, because we all need to pull together.
I myself went through the illness, and I have never been that sick in my life, and I wouldn't wish it on anybody else. And so if there's anything that I could do to help somebody else recover, that I was 100% on board to do that. I also had been touched by a number of other coronavirus cases. I had some very good friends who have lost their older family members, and I wish more than anything that I could have been there to donate that plasma. I think that the one thing that I learned throughout this journey is not as much about myself as actually about all the people around me and how much that everybody really cared. I received a lot of support from my friends and family, and I really don't think I could have made it through the whole process without them.